Everyone, my name is Efren Colazo, and welcome to my final project presentation of the HLAT AA1 Advanced Clinical Practice. My clinical internship was in a chiropractic clinic in Ponce, Puerto Rico, called Vida Practica, and the services that they're providing there are spinal manipulations, therapeutic modalities, therapeutic exercises, and one of the things that are very unique about it is the inclusion of Oriental medicine within the services provided on the clinic. I was providing athletic training services associated to chiropractic medicine, such as manual therapy, therapeutic exercises, and assistance on evaluations. And why? Well, it was a really great opportunity for employment for colleagues. Using my experience to let or express to other colleagues about the incorporation of athletic training and the chiropractic medicine, and was a great opportunity to explore the athletic training value in chiropractic medicine. Therapeutic modalities provided including EMS, electrical muscular stimulation, using the intensity twin stim, called laser therapy with the Avant LC30. This is a 3B class laser. It includes infrared laser. And I was in charge of doing the majority of manual therapy interventions, so ISDM, cupping therapy, therapeutic massage, and also manual joint mobilizations. Charge of doing therapeutic exercises programs using traditional instruments, the loop, dumbbells, the balance foam. And I was more focused on working on neuromuscular function instead of increasing strength and all those things because it was a very different population, and the clinic doesn't have a gym with all the instruments or the weights that we needed. So I was more focused on that functions. And using the iron neck, as you see, this is a really nice instrument that you can use for rehabilitation of the cervical spine. And you can, as you can see, this is an instrument that you can attach some bands and work on different range of motion, but you can include some cervical rotation exercises, increasing or decreasing the resistance. So it was very helpful for me to improve our services for cervical rehabilitation and also the motion guidance. This is a visual feedback instrument to improve kinematic function, and you can use in all anatomical areas. So we use a lot with the cervical spine patients, lumbar spine patients, as you can see in the photo. This is for the lumbar spine, trying to point the laser to the board and do different motions depending on the exercises that you want to do. The other services that I provided that it was more in use for the class and for the objectives of the class was the inclusion of patient-rated outcomes. I identify a lot of them, but it was more practical just to have one in general for all the populations. So we use this patient-specific functional scale. This is a patient-rated outcome that have a lot of validity and reliability in healthcare, where you write all the different skills or actions that the patient do typically in life or in sports, and then you grade it from 0 to 10, 0 being uh, not able to do it at all, and then 10 do it without any problems. So it's an opportunity for the patient to integrate to the evaluation process and establish the goals based on what he's looking or she's looking for to improve functionally. And the physical screenings, we included the selective functional movement assessment. It's part of the FMS family. So in this screening, it's part of the evaluation. We do different testing to look for the functionality of the patient, from the head to toe, from cervical to low back to the lower extremity, and you grade that functionality. And it was very important for us because It was a tool used by the Dr. Lugo to get more concentrated on those dysfunctionalities. And we integrate the exercises with the therapies that he provided based on the results on the screening. So it was a very effective tool for us. The objectives of the student will construct evidence-based cervical and lumbar spine impairment preventions intervention based on patient education resources and therapeutic exercise programs. Yes, it was accomplished. I completed some videos and were associated to cervical rehabilitation, and then another video for manual mobilizations of the lower back. So I had the opportunity to create that, so we accomplished that objective. The student will collect epidemiological data on cervical and lumbar spine impairments in order to present reports for improving logistic and healthcare services within clinical scenario. Yes, because we have some data, but I would say no at the same time because we didn't have enough data. I was there just only Tuesdays and Thursday, and I did collect that information when I was there, but not all the time was collected for all the patients. So do we have some information? It should be very good if we can do it constantly every day and have a huge amount of information when we can get or have better clinical decision makings. The student will design a comprehensive evidence-based testing battery for the identification of cervical and lumbar spine impairments. Yes, we accomplished. We completed a battery test for evaluation of the lower spine or lower back. The student will identify, utilize, and interpret the results of patient-reported outcomes and clinical prediction rules with patients suffering from cervical and lumbar spine impairments. Yes, because as I said before, we have some information and we base our services uh, relying on that information that we identified. But at the same time, there was not a lot of information. That's one of the things that we should improve in the future. And we didn't use a lot of clinical prediction rules because it was very difficult to include it in the evaluation process. And we need to have better communication with physicians with clinicians to integrate those instruments to the evaluations. And finally, the student will demonstrate the application of manual therapy interventions associated with cervical and lumbar spine impairments. Yes, we accomplished that with the videos and all the different interventions that we had on clinic. Interventions, and first is the evidence-based cervical exercise program. This is a video where I show different techniques and instruments to do rehabilitation of the cervical spine. You can follow the link, it's on YouTube. And also I present some research about these techniques or instruments and how they can improve the patient's cervical function. Manual joint mobilization video for the lumbar spine. Also, you can follow the link on YouTube and you can see different techniques of manual joint mobilization to improve uh, lumbar spine function, including some research about the best evidence regarding to manual joint mobilizations of the lumbar spine. We constructed a battery test for the lumbar spine evaluations. I researched for some articles and some references to do a battery test based on the most important findings and how I can use those findings to have different categories and establish what is the most uh, likely injury condition that we are evaluating on that evaluation of the patient. So based on sign and symptom, predisposing factors, and the best orthopedic testing based on research. And then when you have all the findings, you gave a 1 point for each finding, and then you sum all the points and establish what is the condition that is mostly or more likely to be diagnosed on the evaluation. There's an increased number of patients, as you can see. I was there basically in 3 months, September, October, November. Uh, and in total, we see the Oriental medicine patients 65, and then three rehabilitation and treatment programs. And then in November, we increased it to 118 patients and 21 doing rehabilitation treatment programs. So it was a notable, significant increment of patients between the months where I was providing some services in the clinic. Only earnings. In September, we did $7,187, and then in November, we increased it to $18,655 of earnings. So no matter that I don't do a lot of or I don't do Oriental medicine interventions, we were very helpful for Dr. Lugo because now I can be in charge of providing some different services while he was focusing on doing Oriental medicine and have more space between the day to receive more patients. So this is a huge finding about our value or on this uh, profession. I completed a clinical online about the kinematic exercises effects on chronic neck pain. So it was very interesting to see what are the best alternatives to provide some services to control or reduce chronic neck pain. So if you want to see it, just let me know. I can provide to you. The impact. Will this project change my clinical practice? Yes, of course. Why? I learned out now that we are value. We have a value for at least for this profession. We I help a lot, Dr. Lugo, to see a lot of patients to do different interventions. So definitely, I would recommend to any chiropractic to have an athletic trainer and see how I can use this information or experience to help other colleagues to get inside of that world. The value of manual joint mobilizations. I have learned that it's very good for integrating on spinal manipulations interventions to do then manual joint mobilization because you improve that that motion, you improve the decrease of this stiffness and see how the patient is doing in the quality of the range of motion. Now, so that's one of the things that we should integrate a lot in with the chiropractic medicine and the role of athletic trainers on evidence-based practice intervention. I think we can do better on that. Uh, I think we can get more inside of that. Probably taking more time to have more information, to analyze it, to see how we can use that to improve the services. So I think that the athletic trainer could be an asset to get better on those services and provide more evidence-based practice interventions. The evidence-based conclusions, the values of electronic chiropractic. This is a Spangler 2021 report, the role and value of athletic training, when he said that we were valuable because we can do a lot of things that are very associated to the services provided to chiropractic medicine, and now I have that experience, and I can assure that we are really valuable for them. And as you can see on the tables, how was the impact of the economic uh, things and how we can provide better services to our patients. Effectiveness of kinematic training, doing the video, I learned that um, they are very effective for improving function and for decreasing pain. So it is recommended that all the interventions to reduce pain should include some rehabilitation exercises program because they are very valuable for healing and decreasing symptoms. And the effectiveness of manual joint mobilizations plus spinal manipulations, they're explained the clinical bottom line. It had been found that uh, that's really important on that, and they are recommended that we can do that with patients. So next step, future research and next step include evaluate the effectiveness of patient-rated outcomes, search for consistency, and try to select the best or the more appropriate patient-rated outcome based on the clinic. We have identified a lot of patient-rated outcomes, but it's very difficult to use all of at the same time. So selecting the appropriate one would be better for results of the clinic. Impact of athletic trainings in organization and administration in chiropractic. I think we are a great professional to do some policy changes if we get more insight of patient-rated outcomes and having more information or results that we can analyze to then present those changes and policies. And finally, inclusion of advanced healthcare interventions as using virtual reality training or manual joint mobilizations. That's one of the clinical intervention that we can get more in deep, and we're going to increase more value, not even in chiropractic, just in all different healthcare professions. Elective trainers are valuable healthcare professionals in chiropractic medicine. Evidence-based practice intervention should be practiced with more significance, and therapeutic interventions such as manual joint mobilizations and kinematic training increase recovery and healing when provided in conjunction with chiropractic medicine. And effectiveness of oriental medicine. This experience, I really believe that it have showed to me that that is a really good intervention, and it helps patient to get better. Those are my references. Thanks for watching.